What's going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. We're continuing on with the vital signs assessment series, and today we're going to be talking about temperature. Let's get started. So to begin our assessment, we really need to understand what the normal ranges are. And there's several different kinds of assessments you can do when it comes to temperature. The three that we're going to be focusing on is oral, rectal, and axillary. There's other less common measurement sites such as inside the ear as well as the temporal, which is across the forehead. However, we're not going to be talking much about those today. So when it comes to oral, we have a normal range of 36.4 to 37.5 degrees Celsius or 97.5 to 99.5 degrees Fahrenheit for the average healthy young adult. When it comes to rectal, you're usually going to have a 1 degree Fahrenheit or 0.5 degrees Celsius higher temperature. And when it comes to axillary, you're going to usually have a 1 degree Fahrenheit or 0.5 degrees Celsius lower temperature. So let's look at how three of those are performed. So to begin with our oral temperature, we need to gather the equipment that we need, and that's usually our thermometer as well as our probe covers. So you want to place the probe cover over the thermometer to prevent any kind of cross-contamination from occurring. You want to place the probe under the patient's tongue at the posterior sublingual pocket and ask the patient to close his or her mouth. If the patient has had recently consumed some kind of hot or cold foods or liquids, or has smoked or chewed gum, the nurse really should wait 15 to 30 minutes before taking an oral temperature because this helps us prevent getting false results. Asking the patient to breathe through his or her nose helps prevent the patient from opening his or her mouth, which could also give us a false reading. Leave the thermometer in place for at least 3 minutes or until the device beeps. Next, let's look at our axillary temperatures. You're going to need the same equipment that you use for the oral temperatures. It's just in a different place. So the procedure begins, you want to make sure you're placing that probe over the thermometer to prevent any kind of cross-contamination. And then you want to place the probe underneath a dry armpit, also known as the axilla, and you want to press the arm against the body. You're going to leave the thermometer in place for 5 minutes or until the device beeps. This is used for patients who are unable to follow commands or have some kind of contraindication for having oral temperature placement, such as like jaw surgery, could prevent you from being able to use the oral temperature route. Lastly, let's take a look at the rectal temperature procedure. So again, we're going to be using the same equipment. I highly recommend though that some facilities will use thermometers that have a red dot on top of them. That's usually an indication that that is a rectal temperature probe and not an oral temperature probe. So make sure that you're not using the same probe that you shove in the rectum as you do in the mouth. So that's very important. When it comes to the procedure, you're going to place the probe cover over the thermometer to prevent that cross-contamination. You want to place a little bit of petroleum jelly on the bulb of a rectal thermometer just to help kind of with the ease of getting in. You're going to place the patient in the Sims position, as you can see here, or on his or her side and spread the buttocks to expose that anal canal. You really want to make sure that you're careful not to insert the temperature probe too far in, and you never want to struggle to push that thermometer further. If you're struggling, take it out, maybe reposition the patient and then try again, and you never want to shove the whole thermometer in. We don't shove the whole thermometer in our mouths. We don't want to shove the whole thermometer in the rectum because that can actually cause perforation if you were to be too rough and go in too far. So you never want to go more than 1.5 inches or 3.8 centimeters when it comes to adults. You want to leave that thermometer in place for 3 minutes or until the device beeps. So this is traditionally used for patients who are unable to follow commands or have contraindications for other temperature placement methods. You'll see this a lot in the intensive care units with our sedated patients where they may have a flexi seal in to help with fecal management. So they'll also have a temperature probe in there as well to get core body temperature. If we have somebody who's, say, post-cardiac arrest and we're doing targeted temperature management, we absolutely are going to be looking at the core temperature as well. So those are some indications as to why we would use this. Some contraindications as to why we wouldn't use this is for patients who are at risk or actively having seizures. Our cardiac patients, due to the potential for vasovagal, rectal surgery, if there's any kind of surgery down there, we don't want to be shoving in thermometers. Diarrhea, fecal impaction, because those might give us false results, as well as any kind of rectal bleeding. So let's look at some nursing considerations when it comes to temperature, the first being the time of day. So lower temperatures are found in the time between awakening due to muscle inactivity. So you might have those lower temperatures. And when it comes to the afternoon temperatures, they may be higher than normal due to metabolic processes, activity, as well as environmental temperatures. So you could see a range depending on the time of day. Other nursing considerations are the environment, like we talked about, lower body temperatures in cold weather, as well as higher body temperatures with warm weather. Age, temperature fluctuates during the first year of life because of an infant's heat regulatory mechanism being developed. So sometimes with the little babies and little infants, you're going to see fluctuations in temperature. Physical exercise, large muscle exertion causes heat, which will raise the temperature. Menstrual cycle, temperatures decrease just before ovulation and may increase 1 degree Fahrenheit during ovulation. Pregnancy, temperature may stay higher than normal because of the increase in the metabolic rate for women as they're developing their babies. Stress, emotions can cause hormonal secretions, leading to increased heat production as well as higher temperatures. And then lastly, infections. Infective material and inflammatory responses can cause an increase in temperature. So we see that a lot with our septic patients, where they have this bloodborne pathogen infection from pneumonia, cellulitis, whatever the case may be. The infection is introduced to the bloodstream and it's carried throughout the body, right? So we have this immune response with our defensive system in an attempt to eradicate the infection from the body. So based on that response, you're going to see an increase in temperature and a fluctuation of the temperature depending on how well the body is able to handle those infections. So lastly, let's look at some critical thinking when it comes to temperatures. So what is considered normal for my patient? Well, depending on the results, you may want to recheck temperatures either using the same method, a different method, or even maybe using a different machine. Depending on what's going on with your patient, you might have to do all three of these. Not every patient will have a normal 98.6 degree Fahrenheit temperature. So this may be considered high in some patients. So if you have a patient that's temperature is normally low and now they're 98.6, this might actually be the start of a fever for them. So it's important that you're following your trends when it comes to temperatures. And lastly, it's important to find the underlying cause of hypothermia or hyperthermia and treat it before it inevitably leads to something worse. I hope that these videos were helpful in understanding vital signs assessments. Make sure you check me out on my social media. I'm on Facebook and Instagram. And if you haven't done so already, make sure you subscribe here on YouTube and turn on that bell notification so that way you're notified every time I post a new video. Go over to my website at www.nursecheung.com where there'll be additional resources based on these vital sign videos. But until next time, I hope you're having a wonderful day and I will see you all again soon. Bye.